if I have epilepsy, can I have children? And second part, if I have children, will my children have epilepsy?
Sure. It's a bit of a complicated question to answer, but yes, if you have epilepsy, you can have children. A lot of epilepsies, like different epilepsy syndromes, tend to run in families. Something like juvenile myoclonic epilepsy, 50% of patients have some kind of family history of it. Absence epilepsy, a lot of patients have a family history of it. So the chances of your kids having it may be increased. I don't have an exact number because there's different types of syndromes that run in different families, but you can still have children, and hopefully, knock on wood, they may have epilepsy or they may not. I may also defer this to peds who may know more about genetic epilepsy syndromes.
So actually, the average risk if a mother has epilepsy, the child has epilepsy, as the average is 5%. Not that high. Because it depends, like if definitely if you know like a single gene mutation cause that, maybe a little bit high to pass around, then yeah, but the average wise say it's only about 5%.
And also to add, if the individual has a generalized epilepsy, then the chance of passing is much higher compared to someone who had focal epilepsy.
Sure.
And then also
one
to
more thing I
add
have to
another
add.
is majority of the epilepsies are considered as genetic. Now we might have a mutation. You have those potassium channel mutations, sodium channel mutations. So you have all these different type of, and then you have the de novo variants and genetic variants with if it's autosomal recessive or dominant inheritance. There's just so many different, but majority of the epilepsies are considered to be genetic, especially if in the absence of malformations, bleeds, and any brain damage. But otherwise, yes, I say is if the mom had it or dad had it, there's a high likely chance that they will pass it on. Dr. Saraya, you were saying something, sorry.
Yeah, so what I was saying is that if the genetic of the epilepsy in the parents is known, and then they can seek what we call as a genetic counseling, and that would be true for any other disease process. But having, if a woman especially having epilepsy does not mean that they shouldn't have babies or they shouldn't get pregnant just because they have epilepsy, so that they are going to pass it to their children, even if the genetic epilepsy is known in them. So it is to be encouraged that it is safe to get pregnant and get to the pregnancy. You may have a child with epilepsy, but it's still not discouraged in general.
Another point: if someone has diabetes, if diabetes runs in your family, do you stop having kids? If asthma runs in your family, do we stop having kids? It's the same thing. Just like we have treatment for diabetes, we have treatment for asthma, we have treatment for allergic reactions. Similarly, we have treatment for epilepsy. So nobody is perfect. Each one of us has something. So if you have this condition, so just the main thing is to acceptance of the condition, and then taking proper measures how to control it. If we can do it, like, I don't think it will cause like too much impact on your life. Ignorance is a major issue. Ignorance and lack of precaution is a major issue.
And I would add one thing more to that, Dr. Mahfouz, very good. You said, I think that also very important that, yes, you're having the kids. Maybe you could speak with your doctor into what medications, because certain medications have a higher chance of having a child with birth defects compared to others. So if someone is on Depakote or phenobarbital versus, let's say, you're going to be on Keppra, levetiracetam, or lamotrigine. So perhaps you could speak to your doctor before you're planning to get pregnant and say, hey, I'm planning to get pregnant. What do I do? Many times folic acid supplementation is required because some of these drugs can deplete your folic acid. Then you're going to have a baby with defects. And then you might think it's because of the epilepsy. No, it's because of all these things that happen in the background. So if you can supplement right the folic acid, and then you can, maybe change those medications, tweak them a little bit if it's possible to do so, and then have the kid, it's pretty safe to have a baby, and then keep your seizures under control during the pregnancy. So having close checks with the neurologist, I think those are going to be important, and also perhaps being closely monitored with maternal and fetal medicine.
Oh, I just want to add on to that. It's I agree, it's a slightly different topic, but women with epilepsy are like a special group that need to be monitored. So as neurologists, we always ask if they're planning a pregnancy, and ideally they should plan their pregnancy. Otherwise, use contraception, barrier contraception, because a lot of oral contraceptives can be lowered depending on the drugs that you're on. But ideally, if you plan a pregnancy, then the neurologist can help monitor and put you on proper medications to prevent any adverse effects from seizure meds.
Great point.
Meant on the epilepsy, the pregnancy registries and the consensus about which medications are safe for women of childbearing years to use, because patient selection before pregnancy is really crucial, because a lot of the defects can happen before you even know that you're pregnant.
Yeah, so I do encourage all pregnant women with epilepsy to register with the epilepsy the pregnancy registry. The meds that are safe are Keppra, lamotrigine, and then newer meds we don't know that much about. Zonisamide is not that new, but there's not many side effects reported for babies. Outside of that, Vimpat as well as Aptium are relatively safe, but again, there's just not significant reported birth defects with it. So especially if somebody's on a newer medication, I encourage them to register with, it's like a national registry. It's a phone number that I give to most patients. The ones to avoid, as you mentioned, are Depakote, carbamazepine. I don't have that many patients on phenobarbital at this point, to be honest with you, and certainly Dilantin as well.
It's the vitamin A with phenobarbital. And so perinatal bleeding is probably the biggest risk with phenobarb. So if someone's on phenobarb, they need to get vitamin K prior to labor and delivery so that the child doesn't have any issues with that. And what are your thoughts about topiramate? Because that one is a little bit troubling because the numbers are so borderline, and yet topiramate is a category D drug.
I don't give it either. I think there's better options for the most part. Unless someone has very severe epilepsy, I would recommend Keppra or lamotrigine. Outside of that, Vimpat or Aptium. So I would avoid it if I could. Same thing with Topamax. That can interfere with birth control. So I always, at like a specific dose of like 200 plus. So I also recommend barrier contraception with topiramate.
We also have to think about our migraine patients that can be on topiramate.
Yeah, and it's not recommended for migraines at all during pregnancy. Most of these meds aren't.
I think the other concern with topiramate is that it does cause weight loss, and weight loss in pregnancy can be detrimental to the fetus. So IUGR can be a theoretical intrauterine growth retardation of the fetus can be a real concern with Topamax. The other there are some reports of cleft lip and cleft palate, I guess, with topiramate as well.